that's part of being an educator. You look for young people, try to get them excited in what it is that you're doing, and then as they develop their own careers, you continue to support them. That relationship continues to be so important to this very day for both the trainee and the trainer, because the trainer also continues to be a trainee and keeps learning.
That was Dr. William Schaffner, who is the professor of preventive medicine and infectious diseases at Vanderbilt University School of Medicine. Many of us know Dr. Bill because he is an often tapped resource for infectious disease education. During the recent pandemic, his interviews were featured on news outlets very often. Bill is passionate about health, vaccines, and disease prevention. When not teaching or doing clinical trials, he volunteers at the Elephant Sanctuary about an hour outside of Nashville. In this Squeeze of the Day, let's learn about his drive for health and his passion for members of the pachyderm family.
We're glad you joined us to hear these inspiring stories from older adults, people who have so much experience and words of wisdom to share, but are sometimes overlooked in society today. I'm Sally Hussey, the CEO of 50 Forward, a Nashville-based nonprofit. Our mission is to support, champion, and enhance the lives of those 50 and older.
And I'm Susan Sizemore, your guide through these beautiful conversations with those who are living life to the fullest and who know how to squeeze the day in their second chapter of life. Now, in my second chapter and encore career, I'm following my passion for sharing the stories of older adults with you and with the world. Because of that, we're now doubling up on our episodes each month. If you like what you hear, please rate and follow Squeeze the Day on your favorite podcast platform. Today's Squeeze the Day is brought to you by the All of Us Research Program from the National Institutes of Health. Learn how you can help change the future of health by participating in the program. Visit www.joinallofus.org to learn more. So nice to have you today. And it's kind of like seeing you on TV, which many of us have done through the years since you've been on television frequently to talk about infectious diseases.
Well, it does happen. And it's all part of our educational institution here. We try to provide good science-based education so that people can understand what's happening with infectious diseases generally. And it's been busy during the COVID pandemic, of course.
Yes, thank you so much for working us into your busy schedule. And I really want to start our conversation with learning a bit about how you started your career as an infectious disease doctor at Vanderbilt.
Actually, Susan, it started in medical school. Back then, we had free summers, and I was looking for something to do medically while I was a student in medical school, and there's a long story behind that, but I got involved with a professor who was doing a study in Mexico trying to prevent the gastrointestinal illness, tourist diarrhea, that tourists do get when they go to Mexico. And I had no idea about research. I had no particular interest in infectious diseases until that started. And by the end of that first summer, I was intrigued with developing new information, doing research, working actually outside the medical center where you could catch some of these infectious diseases. And I worked with that mentor throughout the rest of my time in medical school. And so by the time I got to Vanderbilt as an intern, I was already interested, particularly in infectious diseases.
Isn't it interesting how mentors play a big role in life? I think oftentimes we forget to mention that to people, but not only have you been mentored, but I bet you've mentored some people as well.
Oh, well, that's part of being an educator, right? You look for young people, try to get them excited in what it is that you're doing, and then as they develop their own careers, you continue to support them. It's a whole lot like parenting, So even when they leave the formal training that you have here, you have these progeny that are out there, your professional children, and you stay in touch and you revel in their triumphs and you keep doing what you can to help them advance their careers.
That's so wonderful. That's like leaving another legacy, although it really increases exponentially as a teacher.
It surely does. And by associating with young people, it helps keep you young and fresh because they come in irreverent. And when you say something, they say, really? How do you know that? What does the literature say? And that keeps challenging you. And that's very exciting. You know, that relationship between a senior person and the young trainee, it must have established itself for the first time at a university in the Middle Ages in Bologna or somewhere. But that relationship continues to be so important to this very day for both the trainee and the trainer, because the trainer also continues to be a trainee and keeps learning.
Will you talk a little bit about public health initiatives and education related to protecting all of us on a national and global scale? With COVID-19, of course, we've all had firsthand experience of the importance of understanding infectious diseases, but also vaccinations.
So for sure, we're interested in protecting individuals, diagnosing them, treating them appropriately, and we've made major advances in that regard. But at the same time, the public health community, those investigators have been trying to figure out how COVID spread, because COVID was brand new when it first appeared, and which elements of the population it affected more severely, and then when vaccines became available, to try to implement vaccines in order to prevent as much infection as possible. So the two are, when it comes to infectious diseases, really interrelated. And being able to communicate clearly to the public so they have an understanding and you can enhance their trust in the recommendations that are provided. And I would say, looking back on COVID, we still have a substantial amount to learn about doing that even better as we prepare for the next pandemic. And there will be one someday.
That's frightening to even think about, but I know we have to deal with reality. And in some ways, I'm wondering, when the pandemic hit, what surprised you, and did you ever see yourself maybe as a frequently tapped expert on a pandemic?
Well, you know, Susan, there have been some previous global or regional outbreaks of illness. I think of HIV back in the 1980s, and I certainly lived through that. And then there was Zika virus, the annual influenza outbreaks and pandemics. We had the 2009 influenza swine flu outbreak, and there have been others. And so I've participated in trying to educate the public and actually caring for individual patients during all of those. But what surprised me about COVID, I hadn't anticipated that we would be faced with a completely new virus, certainly on such a scale. And then as I underwent my educational activities, I was surprised and disheartened about how politicized the response became and how trust in infectious disease science just kind of diminished. And that bothers me to this day. We have a lot of work ahead of us to try to restore that sense of trust that people have in science and in public health.
Can you think of things that have been significant contributions or milestones in infectious disease research recently?
Oh, well, let's look at COVID. Remember, when COVID hit the scene, we opened up our textbooks and found only blank pages because we didn't know anything. And the research in the laboratory has been extraordinary. Think of it. Within a few relatively short months, we had a diagnostic test that was so rigorous, we could do it at home. We had drugs that could work to prevent severe disease, and we evaluated other medical compounds that we discovered, although we had an initial flare of enthusiasm for them, they didn't work, and we had to put those aside. And then, of course, the development of the vaccines. That's all in the laboratory. Then clinically, we had to learn how this virus affected our human condition, the organ systems, and we became much, much better in actually treating people and making them better so that they could leave vertically rather than horizontally our hospital. And on the public health side, the research really investigated how this virus spread, how the different variants occurred, the implications of that. So the amount of research globally, not just here in the United States, to which Vanderbilt made major contributions in each of those areas, has been very, very exciting. So just looking at COVID alone, it's amazing how much science has been able to contribute to how we as a society have been able to respond to this pandemic, this threat. When the going gets tough, the tough get going. And I think the research community just kind of said, okay, let's see what we can learn about this as quickly as we can and turn it into practical, good things so that we can intervene in order to prevent as much serious illness as possible. And the world's research community certainly responded. I mean, it's been an astounding triumph. Now, how well we implement these interventions, that we could still improve upon. And I hope we've learned some lessons so that we're even better prepared the next time.
So I'd like to talk a little bit about clinical trials, too, as we're talking about science and research. When we're approached to do clinical trials, what do you think we as individuals and the community should know about them?
So let's set the stage a little bit. Clinical trials occur, and we're talking about therapeutic clinical trials, for diseases for which really excellent treatments are not available. They're kind of halfway treatments. And the diseases are often serious, various forms of cancer, for example. But there may be new treatments on the horizon that have been developed in the laboratory, but haven't yet been shown to be effective in people. So now we have the opportunity to say to people with these illnesses, you have standard treatment, you have this new treatment. Would you like to participate in a trial where you randomly will be assigned to either standard treatment or the new treatment? And we have to discuss this and provide all that information to patients. It's wonderful how many people volunteer, not only on their own behalf in the hopes that they get the new treatment, which they hope will be better, but also in order to benefit the next patient that comes along that has the same illness. So they do this for their own reasons, but also they're making a contribution to the development of knowledge so that the next generation has that benefit.
So in a lot of ways, while there could be some risk, there's usually more to benefit from a clinical trial because you're helping future generations.
That's correct. And all of the issues related to the clinical trial are explained to you, and at any time, you may elect to drop out of the clinical trial. You can just tell the investigator, sorry, change my mind. Please make sure that you put me on the routine treatment. And there's no penalty for that. The patient remains in complete control. We have an extended family member who at the moment is receiving cancer chemotherapy, and they were provided the opportunity to engage in a clinical trial. And I didn't participate in this decision. I just answered their questions, but they elected to do that. And I was so proud of them for doing it.
It's good to know. And it's good to hear it from a medical professional, because I know that when people confront us or present those opportunities, sometimes it's hard to make a decision and an informed decision without having the background or the research. I want to talk a little bit about the All of Us research program. Vanderbilt University Medical Center and 50 Forward are both involved in this effort, and I want to know how you believe participation in programs like this will advance precision medicine in the future.
So let's talk about this a little bit. You know, some medical advances can be studied in a relatively small number of patients. You can tell whether a new treatment will work or which patients are more predisposed to one kind of an illness or another. On the other hand, there are many things, many questions that can only be answered if you study a very large number of people. And the excitement about all of us is that people are being asked to enroll in a program, not just here, but in many locations around the country, to have really hundreds of thousands of patients enrolled so we can study them going forward. And we will learn so much more about the occurrence disease, perhaps genetic predispositions to illness, perhaps genetic interactions with certain treatments going forward. I'm so excited for the next generation of medical students because there will be advances that they can take advantage of to provide so much better treatments for the next generation of people whom we have here in the United States. So I encourage patients to learn about this program, all of us, and see if they would like to participate in it. You know, I think of it, heck, I'm a medical scientist, right? As a bit of an adventure, a fun thing to do with everybody else who's enrolling, because we're enrolling to help make the future better. And isn't that something exciting? We could use something like that, all of us.
Without a doubt. Are there research projects now that either you or Vanderbilt are working on that might be of interest to us?
Well, just in general, I'm doing now public health-oriented research, and in conjunction with other sites under CDC sponsorship, we're doing a lot of study on certain communicable diseases, COVID among them, influenza, RSV infection, and patients who are hospitalized. And so we gather all of those data. And then when you hear the CDC talk about the nature of these infections, which populations are being affected, those are our data that they are representing. And so it's very exciting to participate in defining these illnesses and assessing, for example, how well the vaccines work to prevent these illnesses. So Vanderbilt, my group, is making those contributions, and we're very, very pleased to do that because those data help determine public policy on how we respond to these infections.
How do you stay healthy, and what advice do you have for others to be mentally and physically sharp?
Well, I guess my recommendation, Susan, would be the usual. Be observant of your diet and your weight. And of course, exercise is so very, very important. I've never been a highly skilled athlete. So you'll have to choose what you want to do, but I've been a lifetime jogger, not runner. I'm just a jogger, but I have done that. And yes, I've managed to get to the gym 2 or 3 times a week and move some weight around from point A to point B to just bolster a little bit of strength training also. And I think all of those things together have helped, as well as being attentive to, at least through most of my life, getting enough sleep.
It seems like all of those things we hear about, but we probably don't practice them as much as we need to. What about water consumption? Just curious.
Oh, well, always keep up your fluids. That's very, very important. And here we are in the midst of an extraordinarily hot summer, all the more important. And the fluids, be aware, coffee and tea are diuretics, and alcoholic beverages don't count. It's the other kinds of fluids, the more benign ones, that are important. Water works.
That's a good hashtag, water works. One of the things that I noticed in looking at your background is not only that you're doing teaching and research, but you also have clinical responsibilities. How do you balance all of that?
Well, I've helped take care of people with infectious diseases for over 40 years. And yes, I suppose for all of us, the day is never long enough, right? And there's always more to do than there seem to be hours in the day. So trying to get some balance, paying enough attention to your family because of those rewards that are so important, and getting diversions, things that give you joy that are different, whether it's just taking a walk outside and being happy with nature, or having a stamp collection, or doing some woodworking, as a friend of mine does, or having a game of poker with the fellas, whatever. I think those things, and maintaining connections with other human beings in your society, being aware of what's going on, yes, politically, because you'll want to make your own contributions through your votes with what's happening in your government.
That's a good reminder always to stay active, and not only active in the community, but active in casting a vote so that you've got the right representation. I want to talk a little bit. We're heading into flu season, and there's always opportunities to get vaccinations, but what do you have to share about the upcoming flu season?
Well, this winter respiratory season is going to be a little bit different in terms of vaccinations. Previously, we obviously recommended that everybody get their influenza vaccine if you're older than 6 months of age. That's the recommendation. Pretty simple stuff. The virus changes periodically, so we have to keep our vaccine updated. Now, that will be ongoing this year. In addition, we'll have a new COVID booster, a monovalent vaccine. We don't have it in hand yet, but we anticipate it will be available by the end of September, and there will be recommendations as to who ought to receive that. I can assure you that people who are at high risk, who are older, have underlying illnesses, who are frail, who are immune compromised, women who are pregnant, they're all for sure going to be recommended to receive this COVID vaccine booster. And there may be others. And then to top it off, for people age 60 and older, there's a newbie, because just this year, we've had new vaccines licensed for people age 60 and older against RSV. Now, that's a virus that we're not as familiar with, but it actually causes in many seasons as much serious respiratory illness in older persons as does flu. So we have that new vaccine. So this is going to be a learning season, vaccination-wise.
You know, I'm curious also, just because I know this has happened to a number of people over the age of 50. Can we talk a little bit about shingles vaccines?
Oh, sure. We know about shingles. Shingles is actually the chickenpox virus. We all got chickenpox when we were younger, and we got over it. What we didn't know is that the chickenpox virus never left us. Although we got better, it went into hibernation in our bodies. And 10, 20, 30 years later, it can reflect itself in this illness called shingles, which can, over a segment of our bodies, cause a rash, a red rash, associated with not only itching, but pain. And then as it resolves, the pain can continue, sometimes for months afterwards, and really be life-altering. And as it turns out, at least a third of us will experience at least one episode of shingles in our lives. And we have now a shingles vaccine that's remarkably effective, that's recommended for everyone age 50 and older. So if you're in that age category, 50 and older, and you haven't received shingles vaccine, please ask your doctor, ask your pharmacist. It's available, and it's excellent.
I want to talk a little bit about older adults. As a nonprofit, one of our values at 54 is to work with integrity and to hold ourselves accountable as we serve and benefit older adults. How do you see integrity fitting into the work you do?
Oh my gosh, Susan, integrity, trust, that's fundamental to everything that a physician does. We have the privilege and the responsibility of interacting with individuals often at an extraordinarily stressful period in their lives, and stressful for their family members also. It's when they get sick, right? And we're asked to help them overcome that illness. And so people in confidence give us very, very private information about themselves. So we must have that trust. We must earn it and maintain it day in and day out. And this sense of trust, this willingness to share information and to receive recommendations clearly from people in medicine and in public health is something that has eroded generally in our society. We have to earn it back each and every day. So this is something we imbue nursing students, medical students, everybody who works in medical care with. And we have to tell them that they must earn that trust for every single day with every single patient. And we must be humble in doing so.
Thank you for sharing that. That kind of puts, I think, a microscope a little bit on things from your perspective and sharing candidly not only the vulnerabilities, but maybe the opportunities that we have really to understand one another and to respect the medical community.
You know, Susan, elementary to this is that we listen to our patients. Rather than being eager to tell them, we need to be able to listen to them. And in listening to them and acknowledging the importance of what they're telling us is fundamental to establishing that trusting relationship with the patient.
There are moments now where I see kind of the human or the man or the woman behind the practice who's really working to serve as an advocate rather than just trying to get me a prescription and out the door.
You use the word advocate. Let me tell you that a colleague of mine, the chair of the Department of Obstetrics, Dr. Alvarez, and I are asked to address medical students on the first morning of their first day in medical school. And we have a session that introduces them to the notion that they will become, as medical professionals, advocates for their patients. And we talk about clinical advocacy, the sorts of details of medical care where we are concerned for and about our patients. And I also talk about advocacy in actually a public arena, in advocating through our professional societies and institutions for public policies that would extend the benefits of medical care to a larger proportion of our population. So advocacy is so critical that here at Vanderbilt, on the very first day in medical school, we talk to the students and introduce them to the concept that they are becoming advocates throughout their professional life on behalf of their patients and the populations in which they will function.
That's fabulous. That's really good news for future patients and for the medical community, I think, overall, that our children's children might experience. I'm also curious to know something that I read about your background, and it has to do maybe with advocacy and a passion of yours, and that's that you've served not only on the board, but also as an advocate for the elephant sanctuary in Hohenwald, Tennessee. Will you tell us a little bit about that?
Well, Susan, that's part of life balance. It was something that I was introduced to by my wife. My wonderful wife, Lois, is an animal person. And she had me accompany her to a meeting some 25 plus years ago, just in Green Hills, where a small group of she and her friends were talking about creating an elephant sanctuary in Tennessee. And I was sitting off to the side. I was there as her driver and companion. They were discussing this. And I remember saying to myself, an elephant sanctuary in Tennessee, that's the most cockamamie idea I've ever heard. And here I am, a member of the board. And it's very exciting. These extraordinary animals, some of them abused, some of them ill, no longer wanted, have been on display in circuses and zoos for a long time. And they can now come to the Elephant Sanctuary in Hohenwald, Tennessee. We have over 2,800 acres, and they can behave as elephants and interact with each other in a remarkable way. Go to elephants.com. You will become entranced. And if you have children and grandchildren, they will be even more fascinated. These are fascinating fascinating creatures.
Did the elephants relate at all to your medical practice?
I was afraid you would ask. One of the things I learned was that elephants can actually contract tuberculosis, the same kind of bug that causes illness in humans. And very little was known about TB, tuberculosis in elephants. And so, along with the veterinarians at the sanctuary, we have contributed to working with other people who are interested in captive elephants in zoos, in circuses, and the like, both here and around the world, to learn more about how to diagnose this illness early and how to treat it more effectively in elephants. So, as it happened that I was an infectious disease doctor, turned out to be an unexpected benefit as I got more and more involved with the elephant sanctuary.
You know, they say there are no coincidences in life. So there you go. I think that's super interesting, though. We have one question that we ask all of our guests, and it has to do with advice that you might have received from a parent or an older adult that at the time you thought was just silly, but now that phrase rings true in your everyday life.
Let me give you two. The first came from my mother, who was an extraordinary person. And I didn't think it was silly at the time, but it's become more profound as I've gotten older. She was an unlettered person, a very simple person, an immigrant to this country from Germany. And she told me that the paramount characteristic of a civilized person was kindness. Well, it's another way of expressing the golden rule, isn't it? You know, do unto others as you would have them do unto you. And the older I've become, the more wise her teachings have been to me. And I think if we were kinder to each other, there would be less tension, there would be less divisiveness, there would be less violence, there would be fewer wars. So I've quite become convinced that my mom was correct about that. Now, the other thing comes from a colleague who, when presented with opportunities to do something, he would always advise his colleagues, go for it, do it. Just don't worry about all the barriers or the considerations, just jump into it. And I've always been a little more conservative about that. But as I look back on my life, I think my friend was right. Just do it. Go for it.
Nike would love that statement. So, Dr. Bill, what is it that you do to squeeze the day?
The first thing that comes to mind, it's a fun thing to think about, is that as I get up in the morning and I engage in my stretch exercises and try to do a little work with my dumbbells and then shave, while I'm doing that, I have the news tuned on to television. So that's one occasion where I think I can get myself ready for the day, but also listen to things that have happened overnight to keep me up to date and ready to go. And as you know, the news is often, especially recently, full of information about infectious diseases. So I have to know what's being broadcast in order to help being functional during the day.
Thank you so much for joining us today. Your story is inspiring and it reinforces that challenges can become opportunities. We learn so much from one another and certainly from experiences of those in their second chapter of life. Now we challenge everyone listening to go squeeze the day. Squeeze the Day is made possible through listeners like you. If you enjoy this podcast, please help us continue to share inspiring stories of older adults and visit 54ward.org. That's FIFTYFORWARD.org to make a contribution. Now, as I leave you today, I'm sending you all a big squeeze. Until next time.